So while we move to a world of health tech and med tech, and this seems to be, the excitement and buzz, and while technology is undoubtedly changing the way we treat cancer patients, and the medical advances that are, brought forward through technology is just phenomenal. So we can't deny the importance of tech and the importance of enabling the drug protocol intervention and therapies using technology. Technology also plays a very important role in data insights, in retrieving right amount of information, and also monitoring the patient throughout the journey. Part of the data insights is one very important segment, which is behavioral insights. While a lot of the technology and medical companies today, focus on the medical insights of a patient, there is a big important segment which is behavioral insight, which is not very easy to retrieve just using a medical device or technology which monitors this. What are their behaviors in terms of the kinds of foods that they're choosing, in terms of how they're reacting to an emotional or mental occurrence that is taking place in their cancer journey? What is their communication like? How are they feeling at that moment in that particular time, and why are they feeling that way? These are such rich data insights in terms of the behavior of a patient, because that gives us complete A to Z of what's going on specifically with that patient, and how that patient specifically is responding to the treatment and is actually getting through their treatment journey. This in turn obviously helps with the kind of drug intervention that can be further given to the patient, the type of treatment the patient should be on, what really influences the adherence of that treatment, what are the factors that are really improving the quality of life of that patient, how do we educate and empower that patient better to bounce back post-treatment, how do we educate and empower that patient to stick to a strong and healthy lifestyle regimen, and how do we as overall improve the clinical and non-clinical outcomes of the patient. It's very, very important to know that when it comes to oncology, 100% digitization and technology does not work. Having a trained therapist who is able to interact with that patient and retrieve these data insights on a regular basis is when we can really accomplish a rich source of information that can influence the right methodology in treating the patient going forward. So through CARER, while we assess multiple medical factors and non-clinical factors, our therapists who are trained and who are hand-holding that patient on an everyday basis and helping them implement lifestyle changes are integral in actually retrieving those behavioral insights. And they make a huge percentage of the kind of data output that we get. While we all look at the quantitative figures and we look at the statistics, we can't ignore the qualitative factors and the qualitative statistics that actually make up a large proportion of how patients are doing and how to customize certain interventions based on that. So technology will digitize and will enable retrieving of data and data monitoring and response to treatment to a certain degree and percentage, but the last 20 to 30% is always delivered by human touch, and that plays such an important role of retrieving the behavioral insights.